Okay, now we're going to start looking at two eating disorders in particular, bulimia nervosa and binge eating disorder, and their relationship with obesity. Both bulimia and binge eating disorder, which I'll talk about on the next slide, involve binge eating. Okay, so what is binge eating? These are episodes where an individual, usually in a short amount of time, about a 2-hour window, but it depends on the person, they eat an amount of food that is very large, okay? And not so much just overeating, but there's something else going on that's promoting that. And one of the biggest criteria of binge eating in both bulimia and binge eating disorder is this lack of control. This overwhelming desire to eat, even if the person feels full, even if the person's not hungry, even if the person's prefrontal cortex is saying, don't do this, there's this feels like a monster inside of the person. It's very neural in nature, where there's this desire to eat, even though, and they can't kind of override it with this system. And that might be really hard to understand if you've never experienced this. I've dealt with both forms of bulimia and binge eating disorder, and it's not that I'm not a smart person. It's not that I didn't know that I shouldn't be eating that much, but it really felt like this overwhelming urge. It was like this. It was like, oh my gosh, I couldn't stop myself, which is so hard to understand if you've never been through it, but it's this overwhelming urge that we call lack of control eating, okay? Binge eating usually happens alone. It usually, like I said, happens in a short period of time, and a big part of binge eating as well is there's usually shame and guilt that are associated with it, which unfortunately can actually promote more binge eating as well. Okay, so that binge eating I just talked about is the same in bulimia as in binge eating disorder. The big difference between the two is, where does it say it? Compensation, compensatory behaviors. So individuals with bulimia will binge eat and then compensate somehow. And there's different forms of compensation. Okay, so you probably have heard of the form of bulimia that involves binge eating and then vomiting as a way to get rid of that extra energy. I had a form of bulimia where I would binge eat and then I would overexercise. I would go to the gym for 2 hours the next day. And I was obsessive about it, where I'm I can't, I'm not allowed to leave the gym until, in some cases, I burned 1,000 calories on the machines. Okay, so that's an example of compensation. Laxatives are sometimes used for compensation as well. But even still, individuals with bulimia nervosa, they're hard to kind of see, because individuals with bulimia, often they have a body weight that falls within usually a normal BMI or a little bit closer to an overweight or an overweight BMI as well. Okay. It's important to say here as well that I am generalizing, but there are lots of different ways that these things show up, and everyone's experience is different and everyone's experience is valuable to them as well. I'm just giving you some examples, but these you can't generalize too much because these can show up in very different ways. Okay. I kind of battled between bulimia and binge eating. And like I said, the big difference between bulimia and binge eating is that in binge eating, there's no compensation, okay, or not as extreme compensation. So an individual with binge eating, they binge eat, but they don't overexercise or they don't vomit, okay? But that loss of control eating is still there, okay? So like it says there, it's not associated with that compensatory behavior, okay? As it says here, binge eating disorder is less common but much more severe than overeating. And the big difference between binge eating and overeating is loss of control. Overeating, I think like Christmas. I think like a birthday party. I think a buffet. We overeat in those situations. But binge eating is usually, like I said, alone. There's maybe some mental health things that are going on at the same time. And like it said, it can be a lot more severe than overeating. So a little bit more about binge eating disorder. We often don't talk about it. People don't really know about it, but it is the most prevalent eating disorder. Bulimia affects approximately 1.5% to 2% of people. Okay, affects females more than males. Binge eating disorder affects a larger proportion of people and is more likely to affect males compared to the other eating disorders like anorexia and bulimia. Okay, typically manifests in early childhood, and certain individuals can have loss of control eating without perhaps being diagnosed as binge eating disorder. For instance, if that loss of control eating doesn't happen as frequently. Okay, and just to give a more concrete explanation of this term, loss of control is subjective experience of being unable to control what or how much is eaten, regardless of amount reportedly consumed. And like I said, as someone that's experienced this, I can't even explain it to you. But it really feels like there's a monster. There's something like pushing on the wanting drive. It was very much wanting, right? Where that person wants, or I wanted food, even though I didn't even enjoy eating it that much, or the pleasure of it. It wasn't pleasurable. Okay, there was just something else driving that. Okay, it's easier to diagnose loss of control eating compared to binge eating, especially in early childhood adolescence. So you'll notice some of the studies we look specifically at loss of control eating instead of binge eating. Okay, so for instance, in this study, which looked at overeating and binge eating disorder, where they assessed males and females every 2 years starting in kind of early adolescence. And what they really looked at is whether this loss of control, binge eating, associated eating promoted more eating than overeating. Okay, which I clarified about in the last slide. Okay, so here I have females and here I have males in these slides, and you'll notice that binge eating is the lighter bars, whereas overeating is the darker bars. And you'll notice with females, and this is going from age 9 to age 24, we notice a kind of spike in specifically that binge eating, okay, in those adolescent years. It's not that high. This is percentage on the y-axis, and kind of the maximum percentage of individuals that reported that binge eating was around 3% at around age 22. But you'll notice that overeating was less common. Okay, so again, the big difference between overeating and binge eating being that lack of control. With males, it seems that overeating was more prevalent with increasing age than binge eating. And of course, it depends on how well we were able to assess these things, but this does show that it might be that overeating might be more prevalent in adolescent males, and binge eating might be more prevalent in adolescent females. Okay, so this is from the same study where we are looking now at the effects of binge eating. We'll just focus on the red bar here versus overeating on a number of different outcomes. Okay, so these are odds ratios, I believe. Yeah, they're odds ratios. So we're basically looking at, with odds ratios, we're always comparing to kind of a baseline, and the baseline is 1. The reference is 1. Okay, so overeating, so people that don't experience overeating, we kind of set them at a magnitude of 1, and then we compare people with binge eating on a number of different outcomes compared to how much higher it was in individuals with binge eating or overeating compared to those with no overeating. So individuals with binge eating had a higher risk of overweight and obesity compared to those with overeating. Individuals with binge eating had, again, a higher odds of having depressive symptoms compared to individuals with overeating. Individuals with binge eating had not that much higher risk of binge drinking. Okay. With overeating, there was a much larger association with marijuana use, and we did see a stronger odds of binge eating being linked with marijuana use, but it's interesting that it's higher with overeating. Okay, and there was actually just a higher risk of overall, or higher odds of overall drug use in individuals with overeating and binge eating compared to individuals that don't overeat. Okay, so as it says here, in adjusted models, binge eating but not overeating was associated with overweight and obesity and the onset of high depressive symptoms. Okay, but much higher in individuals with obesity. Okay, that said, neither overeating nor binge eating was associated with binge drinking, okay, which we talked about, and both overeating and binge eating predicted starting to use marijuana and other drugs. Okay, so it again might be linked to that wanting of a drug that we might see higher in binge eating and with drug-seeking behavior too. Okay, so in adolescents and adults, which we haven't looked at, but it's true, binge eating disorder is associated with obesity as well as with depressive symptoms, more depressive symptoms. And it is the loss of control. That's the big difference between binge eating and overeating. Okay, it is the loss of control, not the overeating per se, that was the predisposing factor to higher risk of obesity and higher risk of more depressive symptoms. Okay, so the question we're going to look at on the next couple of slides is, does the loss of control eating that we see in binge eating and bulimia, does that actually shift what types of foods and nutrients individuals that are having this loss of control eating are favoring? Okay, so in this study, the experimental design is that we looked at 177 children aged 8 to 17. And this was an experiment where these children consumed 2 lunchtime meals ad libitum, like as much as you want, okay, from a multi-item food array buffet, okay, and the kids were told to either binge eat or to eat normally, okay, and they found through structured interviews whether these people that they were assessing had prior history of loss of control eating. Okay, so what they found is that youth with the loss of control eating actually tended to favor carbohydrates more and consumed less protein. Okay, also what was found is these kids with loss of control eating, they also favored desserts and snacks and were less likely to consume. Also, they found that those kids with loss of control eating, they were more likely to report certain negative outcomes like higher levels of anxiety, higher levels of confusion, and higher levels of fatigue compared to individuals without that loss of control eating. And this is like kids we're looking at. And so these symptoms are showing up at a young age. And again, as we talked about with things like, there are certain mental health situations that can actually exacerbate obesity as well. So the main take-home message is that loss of control eating is associated with higher risk of depressive symptoms and higher risk of obesity. Loss of control eating shows up in both binge eating disorder and bulimia nervosa. Although binge eating disorder predisposes typically to higher weights because there is no compensation. But both of these situations are more mental health oriented than anything else. Okay, and then, taking a step back, that begs the question, how do we treat individuals with obesity that also have binge eating disorder, that also binge eat? If depression is promoting that binge eating, do we treat the depression first? Do we treat the binge eating first? Or, do we treat the obesity if the obesity is predisposing to the depressive symptoms? And again, it's a good message to just kind of take a step back and to realize that these things are highly interrelated, highly complex, and it's important to consider the individuals and what's going on for them specifically so we can figure out what modalities are going to best help them really just improve their quality of life overall. Another eating disorder, although it's a not specified eating disorder in the DSM-5, is something called night eating syndrome. I bet you it'll be in DSM-6 whenever that comes out. Okay, the original diagnosis of NES basically was brought down to kind of 3 main things: morning anorexia, so a lack of hunger in the morning, okay, evening hyperphagia, eating a lot at night, and a hard time sleeping too, and insomnia. Okay, it's briefly mentioned in DSM-5, but like I said, new area of research, but you're seeing more and more studies come out of this. Okay, in 2008, they held this international conference where a bunch of experts in eating disorders and NES came together to suggest proposed diagnostic criteria for night eating syndrome. Okay, and this is what they came up with. So this is not found in the DSM, but it might be found in the next version. So we might diagnose someone with night eating syndrome if more than 25% of their food intake is consumed after dinner. Okay? And we usually have, like with most eating disorders, usually like it has to happen at least this many times over this period of time for us to diagnose it. So like one episode of binge eating doesn't make someone have binge eating disorder. But if it frequently occurs, then we would say it's more of an ongoing problem. Okay, the person has to remember that it happened. It's not like waking up and like some people wake up and they night walk and they eat. This is different than that. Okay, and they might have at least 3 of the following. So morning anorexia, a strong urge to eat between dinner and going to sleep. Insomnia may be present. Some people with this actually think that they need to eat to be able to go back to sleep. So that is something that we see come up. And in clinical settings, they have found that depressed mood is sometimes associated with as well. Okay? And for diagnosis, they're proposing that at least happens for 3 months to be considered something diagnosable. Okay? So, night eating syndrome is associated with weight gain and obesity in prospective studies. However, what's interesting is there's certain individuals that consume more than 25% of their calories after dinner and still don't have overweight or obesity. And what's believed in these situations is that these people know they eat most of their calories after dinner, so they eat so much less during the day. Night eating syndrome is also higher in populations with other eating disorders such as binge eating disorder, anorexia, and bulimia, again showing that there might be more of a mental health factor that's predisposing to it. Okay? So this is one of the activities I had people do when we were doing this more in class, but we'll do this together here. So when I look at those 3 major eating disorders, I didn't really talk about anorexia, and it's not really the focus when it comes to obesity, although anorexia, previous experience with anorexia can promote mental health issues that lead to other eating disorders or just kind of not the greatest relationships with food as well. So it can predispose to obesity in certain cases. Anorexia nervosa, this is a situation where an individual purposely tries to keep their body weight at a lower level, perhaps through restriction, perhaps through over-exercising, perhaps through vomiting. There's lots of kind of parts to it, but everyone kind of shows up a little bit differently. I'm not going to focus on anorexia. I'm going to focus more on BN and BED. Okay, so in this study, we're looking at scores. And what you might want to do, or what I suggest doing, is comparing this to individuals that don't have eating disorders. Okay, and these significance stars are going to compare those to individuals without those eating disorders. That said, this study is only looking at about 500 adolescent girls between 12 and 15, so we might see something very different at older ages, okay? But this compares individuals' scores that are, compares individuals that are eating disorder free to scores of individuals with bulimia or binge eating disorder, and we see higher levels of functional impairment, okay, in those individuals with BN and BED. We see higher levels of emotional distress, kind of in all 3 of those, but in particular in bulimia and binge eating disorder, okay? We see higher levels of suicidality as well. We see higher levels of mental health, of seeking mental health treatment, if that makes sense, compared to individuals that don't have eating disorders. The body mass index wasn't significantly different, okay, but again, it probably has to do with the fact that we're looking at a younger sample as opposed to an older sample, because as we saw before, binge eating disorder in particular predisposes to higher BMIs and higher risk of obesity. So now that we have a good understanding of bulimia and binge eating disorder and night eating syndrome and how those relate to obesity and how they relate to other mental health issues, in the next unit, we are going to look at what we can actually do about it. And in particular, some kind of ways of looking at obesity and eating disorders in similar lights, because sometimes there's a lot of correlations between these things. And so our approaches to obesity and our approaches to eating disorders could potentially share similar messaging, because certain things that predispose to obesity also predispose to eating disorders, and eating disorders can predispose to obesity as well. So some people consider these things together. In fact, one of my favorite books on this whole topic is actually called Eating Disorders and Obesity, and actually talks about some of the correlations between the two, and how they predispose to both of the conditions, and how we can change our messaging around that as well. Okay, so we'll talk about that in the next unit.